Myself, Dr. Rishabh. I am Additional Director and Head, Department of Critical Care Medicine at Fortis Hospital, Manesar, Gurgaon. So let us talk about sepsis today. What is sepsis? Sepsis is basically whenever you have any infection in your body. It could be anywhere in the lungs, in the abdomen, in the urinary tract, or anywhere in the body. And the body reacts severely and adversely to that infection. And this results in dysfunction or abnormalities in multiple organs in your body. It leads to multi-organ failure and it leads to death finally. So this is a very common entity that we face in ICUs, and it is one of the most common diseases for which patients are admitted in ICU. You'll be surprised to know that out of every 5 deaths that happen worldwide, 1 death happened because of sepsis. So why people are not aware? Because mostly people will be knowing about the primary disease which is happening, maybe pneumonia, maybe UTI, maybe infection in the abdomen, but they will not know, they will not recognize that when this infection is actually hampering your body's organs. How to diagnose this? What are the signs and symptoms of this sepsis? So basically, patients will have fever. Patients will have a localizing sign. If there is pneumonia, patient will have cough, patient will have breathing difficulty. If the patient has a urinary tract infection, the patient will have burning in the urine, patients will have a frequency of the urine. And if there is abdominal pain or fever with chills and rigors, these are basically presenting symptoms of the infection. But when will you say that this infection is spreading? So when the patient starts having breathing difficulty, patients start having difficulty in recognizing things, patient's sensorium, the mental status gets altered, then this infection is likely spreading into your blood and it is affecting the other organ systems. Likely the patients will recognize that they are having a decrease in urine output in last some days or some hours. So these are the common signs and symptoms of sepsis. That is what you should be detecting and should be immediately rushing to the hospitals. The ICUs with all multi-para monitoring, advanced tertiary care level hospitals manage sepsis with the help of intensivists worldwide. So what are the common management protocols that we follow during management of sepsis? So one is early recognition, which is very important. Then it is to give intravenous fluids. The fluid therapy is one of the cornerstones of management of sepsis. Sending investigations like cultures from the suspected sites, sending blood gas analysis to look at the respiratory parameters, to look at the lactate levels of the body. Lactates basically indicates how much your body is not able to aerobically metabolize your carbohydrates. And after that, what is the further treatment? So finally, we have to give appropriate empirical early antibiotic therapy, and we have to give a source control. So what do you mean by source control? If there is a liver abscess, then you have to drain that abscess. So as soon as possible, we have to get a source control. So it is important that you recognize sepsis early and treat that sepsis promptly. This will lead to decrease in mortality because of sepsis. And we at Fortis Manesar are equipped with the advanced ICU care where we are equipped to manage sepsis. Thank you.